Jai Hind, everyone, esteemed alumni, faculties, and friends. A very warm welcome to all of you joining us today from wherever you may be across the globe. It's truly wonderful to see you all as we gather for this Alumni Speak webinar. This webinar we are conducting every month with our prestigious alumni. On the behalf of Pannadhaima Subhati Nursing College, I extend our heartfelt greetings. We are incredibly proud of the achievements and contribution each of you has made since your time here. Your success are a testament to the spirit and quality of education we strive to foster. Today webinar is a fantastic opportunity to reconnect, learn, and perhaps even forge new connections. We have a new insightful sessions planned for you on emerging issues in dengue fever. We believe it will be both engaging and valuable. Thank you for taking the time out of your busy schedule to be with us. We truly value your continuing engagement in this webinar. So now I would like to introduce to Miss Srishti Upadhyay. She was the alumni of Pannadhaima Subhati Nursing College post BSc batch. She is now working as nursing officer in Autonomous Medical College, Firozabad. She is a very good student of our and proud alumni of our Pannadhaima Subhati Nursing College. So now I hand over to Miss Srishti that she can join the session.
Thank you so much, ma'am. Good afternoon, everyone. Myself, Srishti Padre, as ma'am has introduced. I'm working as a nursing officer in medicine department in Autonomous College. So today we are here to discuss about issues emerging in dengue fever. So everyone this term dengue fever. Dengue fever first, you can see in the slide. I think slides are visible. First case of dengue in India appeared in 1812. This is a viral disease, so we don't go in this, but we can go only for symptomatic treatment in this. The dengue fever only found in the tropical and subtropical climatic conditions, and malaria found in the slum areas, but dengue fever found in the urban areas. So we will discuss about definition now. Next slide, ma'am. So dengue is also known as breakbone fever. Why it is called it breakbone fever? If I'll discuss in a layman language, when you are posted in the OPDs or in the casualties, the patient came there and the sign which they come is कि इतना दर्द हो रहा है कि हड्डी तक में दर्द हो रहा है. They say like this. So this is breakbone fever, and it is coagulation coagulopathy disease. What is coagulation coagulopathy disease? Coagulation coagulopathy disease means in this clotting factors do not work properly, so bleeding may occur. That is why it is called it coagulation coagulopathy disease. This is a disease in which is transmitted from mosquito to a healthy person. So its causative agent is arbovirus. The virus which causes the dengue is arbovirus, which belongs to the flavivirus family, and it is of four species: D1, D2, D3, and D4. These are the species of the dengue, and the most dangerous species is D2, and the most common species which is found in India is D1 and D2. And this is mostly the cases occur in rainy season only. And this ages it has a specific like it is also called uh, uh, why it is called It is called a tiger mosquito because this Aedes aegypti has black and white strips over its body. That's why the female Aedes aegypti is called a tiger mosquito. Next slide, please. Next slide. Now we will be discussing about mode of transmission. The mode of transmission is indirect method. Why it is indirect method? For example, let's say a patient having this dengue fever, um, a mosquito has bitten to that person, and again that mosquito goes to the healthy person and bite to him or her. Then this infection gets spread over all over the that healthy person body. That is how this chain started. We will discuss this chain in the next slide also. Now you can see arbovirus, the virus of the dengue, come into the female Aedes aegypti, the tiger mosquito. Then, if this tiger mosquito bites any of the body, next slide, please. Then this virus goes to the bloodstream. Blood vessels get infected with this virus. This is how permeability of the blood vessels get increased. Due to this, plasma leakage occur. Because why plasma leakage will occur? Plasma leakage will occur due to this coagulation coagulopathy. Due to plasma leakage, hypovolemia may occur. Hypovolemia occur, then hypotension will also occur. Hypotension, hypovolemia is there, then patient will have a hypovolemic shock. Once patient got stocked with this hypovolemic shock, then definitely the recovery is very difficult, and patient can undergo hypovolemic shock and then death. So we have to take care that the stages, this stage hypovolemic shock is third stage. So we have to take care of the patient in this stage very critically. Now we talk about incubation period. Usually signs and symptoms may take on 5th to 6th day of this bite. It can range between 3 to 10 days. So it's very clear when the day mosquito get bite, infected mosquito get bite, then the signs and symptoms can appear and can take time up to 3 to 10 days. In this dengue disease, platelet get decreased, due to which bleeding may occur, and due to increased bleeding, shock, hypovolemic shock, hypotension may occur in the patient. Next slide, please. Now we'll discuss about clinical symptoms. What are clinical symptoms? The signs and symptoms. The symptoms which patients are having when coming in the OPDs or casualties. They may have complaint of headache, high grade fever, chills, anorexia, weakness, abdominal tenderness, sore throat, nausea, vomiting, fatigue, and sometimes if it is critical, then hematuria, hematemesis, epistaxis. These are the critical cases. Now we will discuss about stages and grading. Next slide. Stages and grading can be classified as stage 1, stage 2, and stage 3. Stage 1 is the mild stage. This is the only stage if we are treating properly to the patient, then recovery is very good and recovery is fast. So in this stage, it is also called a classical fever. First stage is classical fever, or we can say simply as dengue fever. It is primary stage. In this, patient come with simple signs and symptoms like fever, chills, headache, weakness, and main sign is retroorbital pain. What is retroorbital pain? Retroorbital pain is the orbital ridges of the eye. The patient will complain ki my eyes are paining like hell. So this is a main sign of grade 1, that is mild. Now grade 2, which is called it moderate. This stage is called it dengue hemorrhagic fever. This is a critical situation. In this, plasma leakage occurs. As the name suggests, dengue hemorrhagic fever (DHF). In this, due to decreased coagulation coagulopathy, due to decreased platelet count, due to decreased thrombocytopenia. What is thrombocytopenia? Decreased level of platelets. Uh, so patient platelet will decrease, so bleeding may occur, coagulation will decrease, coagulopathy will not occur properly. So hypovolemia may occur, hypotension may occur, and patient can go further into the stage 3, that is severe. In this, various signs symptoms like splenomegaly and hepatomegaly may also see. The main sign is this increased level of hematocrit. What is hematocrit? Hematocrit is percentage of RBC in our blood. See, if this how can hematocrit will increase? Hematocrit will increase like plasma volume is getting decreased. See, if this is epistaxis, if this is bleeding, so what will you can see? Hematocrit percentage will increase. How? Is there anyone there side want to say? Epistaxis and melena, gum bleeding. These are the main signs and symptoms. And this is the second stage. The stage third, that is severe. Severe stage is dengue. This is called shock syndrome. In this, if patient will not recover in the second stage, then it goes to the third stage. That is dengue shock syndrome. In this stage, all the symptoms as well as shock is manifested. Decreased BP, hypotension, weak and thready pulse, cold and clammy skin. If there is weak pulse, then automatically cold and clammy skin will be appear. Narrow pulse pressure. What is the normal pulse pressure? Normal pulse pressure is 40 mmf Hg. But in the dengue case, it will decrease. It will get narrow, and severe thrombocytopenia may also see. Next slide, please. We will discuss about now sign and symptoms. Okay, level of hematocrit. What is hematocrit? Percentage of RBC in blood. It will also increase by 20% of the baseline. And immunoglobulin test, diagnostic evaluation. What is the main diagnostic evaluation? This point may also come in competitive exams. This tourniquet test, hematocrit percentage, immunoglobulin test. These all are competitive exam points. So tourniquet test will become positive in this, and immunoglobulin test. Basically, there are how many immunoglobulins? There are 5 immunoglobulins: IgG, IgM, IgE, IgE. Which immunoglobulin we have to test in dengue? We have to test immunoglobulin G and immunoglobulin M. Next slide, please. Now we will discuss main diagnostic test, that is tourniquet test. In tourniquet test, there are some steps. There are 4 steps. So it is very easy. What we have to do, we have to just tie the BP cuff on the patient's arm. We have to inflate it, and then we have to take we have to wait for 5 minutes for the pressure. Then we have to release the pressure of the cuff. Then under the cuff area, that is antecubital fossa, we have to see petechi. What are petechis? Petechi are the pink tiny dots of the leaking capillaries. The capillaries, the the capillaries which are leaking blood, and which they can be seen over the skin like tiny pink dots. सी देयर आर द सम कैपिलरीज, कुछ कैपिलरीज ऐसी होती हैं जो कि उस समय ब्रेक डाउन हो जाती हैं। हमने कफ इन्फ्लेट करके हमने बांध दिया, 5 मिनट तक हमने वेट करा, फिर उसके बाद जब हमने अपना कफ हटाया तो हमारे एंटी क्यूबाइटल फोर्स था, जहां पर हम बीपी कफ बांधते हैं, वहां पर हमें क्या फाइंडिंग्स मिलेंगी? हमें फाइंडिंग्स ये मिलेंगी कि वहां पे हमें पेटेकी देखने के लिए मिलेगी। और पेटेकी होता क्या है? पेटेकी पिंक कलर की छोटी छोटी डॉट्स होती हैं। और ये क्या बनती है बॉडी पे? नॉर्मली इनका बॉडी पे अ, होना गलत है, क्योंकि ये एबनॉर्मल साइन है। पटेकी नहीं होना चाहिए। पटेकी तभी होता है जब हमारी कैपिलरीज में रप्चर हो जाता है, हमारी कैपिलरीज में हेमरेजिक कंडीशंस पैदा हो जाती हैं। तो टॉर्निकेट टेस्ट पॉजिटिव कब मिलेगा? इफ पटेकी इज 10 और मोर देन 10, इट इज कंसिडर्ड एज टॉर्निकेट टेस्ट, देन पॉजिटिव टॉर्निकेट टेस्ट। ठीक है, नेक्स्ट स्लाइड प्लीज। नाउ स्टेजेस ऑफ टॉर्निकेट टेस्ट: mild, moderate, severe. Everybody has listened this petechiae, purpura, ecchymosis. Petechiae is a mild situation of tourniquet test. If you tie this tourniquet, na, you will see stages. If you see only petechiae, then it is mild stage, small pink dots. If you see that pink color, see blue, little pink, little blue, but large dot, then it is moderate stage. If you see ecchymosis, what is ecchymosis? Large red color dots, or sometimes it may appear as blue also. Then this stage is severe, as you can see on the image also. Thank you. Next slide. Now the question arises how we can prevent or control. We can use insecticides. There are a lot of insecticides to destroy the habitation, larval habitation. We can remove stagnant water on the terrace, road beds, in the coolers, and outside the house. We can use mosquito repellent. One had should wear long sleeves. One can use mosquito net for prevention of the bites. MCT can this use EDTs, DTs for spraying purpose. Next, now we will discuss about management. See, management can be two: pharmacological management and another would be nursing management. As I have discussed earlier, it is a viral disease. So viral disease do not have any drug of choice. So we can give only symptomatic treatment. जितनी भी viral diseases होती हैं, किसी का भी drug of choice नहीं होता है. Only bacterial disease ही ऐसी होती है जिनका drug of choice देके हम उस चीज को जल्दी recover करवा सकते हैं patient को. So we can give only symptomatic treatment. So symptomatic treatment में क्या हो गया? Patient fever complaint करके आया, तो we can give tablet, PCM tablet, or we can give PCM infusion. And next, fluid replacement therapy can be given. RL, NS. Can anybody tell another name of RL? This is competitive exam question. RL. Another name of RL. Heart. Another name of RL is Hartmann solution. And previous slide, please. Previous. We can also give plasma transfusion. Why we are giving plasma transfusion? Because there is leakage of plasma. And we can also give platelet transfusion. Why platelet transfusion? Because platelet transfusion is given due to decreased level of platelets, that is thrombocytopenia. And ORS will manage the electrolyte levels. Now we will discuss about nursing management. Next slide. Nursing management. What is the role of nurse? Nurse should assess the site for bleeding, nose, gums, stools, hematuria. Nurse can see hematuria, epistaxis, hematemesis. One should check vital signs, too early vital signs. We should prevent injury. Why? Because there is a deficiency of platelets and bleeding disorder could occur. So one should can do tepid sponging and adequate bed rest. Next slide, please. Now, contraindication. This is the main part. If you can't help the person, so you should know what are the drugs which could not use in this dengue disease. There is a drug that is aspirin. What is the function of aspirin? In layman language, if I say aspirin is a blood thinner. Aspirin is a blood thinner, and in this dengue, this is coagulation coagulopathy disease. इसमें डेंगू में प्लेटलेट डिक्रीज हो जाती हैं. प्लेटलेट डिक्रीज होने की वजह से ब्लीडिंग होने के बहुत ज्यादा चांसेस होते हैं. और एस्पिरिन क्या करता है? ब्लड को थिन करता है, ब्लड को पतला करता है, मतलब वो एड्स अप करेगा. तो इसीलिए हम एस्पिरिन को इसमें कॉन्ट्राइंडिकेटेड देते हैं. So aspirin is contraindicated in this, as well as children. If you use aspirin, then they can got a disease which name is Ray's syndrome. What is Ray's syndrome? Hepatic encephalopathy is Ray's syndrome. And that's all about this dengue. Thank you so much.
Thank you, Srishti.
Thank you, ma'am.
It is a very informative session. So, in that, all of you know about the dengue fever and what are the management and contraindications of the dengue fever. So, in that, I want to add some few points regarding emerging issues in dengue fever. They are the few points only that you have to know. Say why dengue fever will be affected and what are the issues will be happen in dengue fever, like climate changes. During climate changes, that it will be happen in that increased transmission rates, expanding vector habitats, and next issue will be challenges in vaccine development. So a vaccine should be provided to dengue for dengue fever and vector control issues. So pesticides or insecticide resistance we have to apply, and urbanization and human behavior also increase breeding sites or high population density, global traveling trade. So due to these issues, that dengue fever will be occur in our community area also. So we have to manage all these things also according to the community area or community health nurse. We have to manage all these things. So end of this session, I would like to thank Ms. Shishti. So she is giving me time for this Alumni Speak webinar, and all thanks to all our students, those who are listening this session, and our faculties and other all alumni, also those are attending this session. And I would like to very heartful thank you to our Geeta Pramanda Madam, Principal of Panadharma Subhati Nursing College, that she is giving this opportunity to us to organize this Alumni Speak webinars every month. So thank you so much. And next month also we will meet then next alumni webinar. Thank you, Sisti, and thank you, everyone.
Thank you, ma'am.